Dr. Brittany from Strathroy Wagner Chiropractic Health and Wellness Centers, bringing you my case of the week. This week's case involves a patient who presented to my office with hip pain due to osteoarthritis. So for this patient, I did an assessment mainly around the hip, checked how their range of motion was doing to determine the degree of dysfunction, and then looked at their muscles as well. With osteoarthritis, this can be a very painful condition. Basically, what is happening is you have two joints that meet. Normally, there's a nice space between them. With osteoarthritis, the space decreases, and there's a cartilage that coats each side of the joint on the bone, and that can wear down over time, which makes it very painful, especially if you're putting weight, like you're weight bearing, running, walking, going upstairs, that sort of thing. So for this patient, what I did is focused a lot on mobility. So working on mobbing the hip, re-lubricating that joint. We worked on stretching out the muscles, so the quads, the hamstrings, the TFL, the glute med, the glute max. And then we also checked the knee and the ankle, made sure they were moving really well because this can affect the amount of force that goes through that hip. And then also looked at the low back because the pelvis is very connected. So did some adjustments to the low back area, adjusted the knee, mobbed the ankle to get that moving. One of the other things that's really important that I educated this patient on is movement, especially early in the morning. With osteoarthritis, people often feel really stiff and painful when they get up because the joint hasn't been moving all night. And it's really important to try to re-lubricate, get that joint moving as early as possible in the day. It's often painful, but if you can kind of push through some of this pain and get that joint moving, it often feels a lot better for the rest of the day. I often recommend, if you can, if you have access to a bike, do some biking, especially a stationary bike is great for these patients. If you have access to a pool, that's really good because you don't have those effects of gravity. But if you can't do those, a really great thing to do is to stand and put all your weight on the hip that is still good, and move the other hip back and forth to the side and do some circles clockwise, counterclockwise, just to re-lubricate that joint. So with this patient, I advise that as well, and then some strengthening exercises to do at home for the glutes, the quads, and the hamstrings.